Very early on in the assay development, Alex Richter analysed patients with Kawasaki syndrome, paediatric patients with Kawasaki syndrome. And these are children who have had no symptoms of the virus, but at a later date have developed an autoimmune type of condition. It was shown in a small study that in these children that had this Kawasaki syndrome, all of the children that were in the hospital with Kawasaki syndrome had antibodies against the SARS-CoV-2 spike protein. And so we've also sent reagents down to South Africa, for instance, who are also experiencing an increase in Kawasaki syndrome patients to see whether they are also children that have been infected by the virus.
Because of the flexibility intrinsic in the test, and applying it to the children with PIMS-TS, we were able to identify that these children did not have IgM, but had IgG. And that's really important because it was the really first evidence that these children had had their infection quite a long time ago, or at least that's the most likely interpretation. And so what we were looking at was not an active current infection, but the consequence of an infection quite a while ago, weeks, maybe even months. The university, through the Institute for Global Innovation, have provided us with funding that helped develop this test. Then after the development of the test and the impressive quality assurance and testing in-house that has followed this, is that the Binding Site had worked with the University of Birmingham and with the University of Cape Town to supply these tests over in South Africa. And what this will do is, we know at this precise moment towards the end of July is that South Africa is in the midst of its exponential phase of the epidemic. And this will be a really, really impressive use of the test in a low middle income country environment.